It's Friday, December 20th, and this is the Daily Medical News, where we bring you clinical medicine's top stories, as well as a closer look at the day's biggest story. I'm Terry Rudd.
And I'm Molly Collegio.
We're going to start the show with some news of our own. This will be the final episode of the Daily Medical News. We'd like to thank you all for making the Daily Medical News part of your everyday routine. And we'd like to remind you that you can still catch all the latest news in clinical medicine on our website, www.mdedge.com. And now, here's what's happening today.
A federal appeals court rules the ACA's individual mandate is unconstitutional.
More U.S. teens are vaping marijuana.
How an outreach program improved heart failure patients' treatment compliance.
And why osteoporosis treatment for at-risk older patients may be on the decline.
And now, the news.
A federal appeals court has ruled that the Affordable Care Act's individual mandate is unconstitutional. But the panel sent the case back to a lower court to decide how much of the rest of the law could topple along with it. The decision upholds a December 2018 U.S. District Court decision. That court found that the individual mandate, requiring most Americans to have health insurance or pay a fine, was unconstitutional, and that without the mandate, the ACA itself was invalid. In sending the case back to a federal district court, however, the appeals court is asking for a central question to be resolved: whether the individual mandate is severable from the rest of the law, while the rest of the law can be left intact. If the district court eventually decides that the individual mandate cannot be severed from the rest of the ACA, the entire law will likely be ruled invalid. The Trump administration chose not to defend the ACA, but it doesn't seem entirely prepared for what might happen if the law is overturned. In a briefing before the Fifth Circuit hearing, the administration argued that if the law is ruled unconstitutional, it should be struck down only in the states seeking to overturn the law.
Vaping has expanded as a popular method of drug delivery for U.S. teenagers, and 1 in 5 students in grades 10 and 12 reported vaping marijuana in the past year. That's according to results of the 2019 Monitoring the Future survey, conducted by the National Institute on Drug Abuse, or NIDA. NIDA officials say the findings continue to illustrate a clear shift in teens' pattern of drug taking. Use of alcohol and drugs, including opioids and stimulants, continues to decline among teens. But vaping continues its significant rise, with a surge in marijuana vaping this year. Past month marijuana vaping among 12th graders rose from 7.5% in 2018 to 14% in 2019. That represents the second largest one-year jump tracked for any substance in the survey's history. The largest jump was in 2017 to 2018. Positive trends in this year's survey included a reduction in the misuse of prescription drugs, including OxyContin, Vicodin, and Adderall. There was also a drop in the use of traditional cigarettes and other tobacco products, as well as alcohol.
Treatment guidelines are clear about optimal treatment of heart failure in patients with reduced ejection fraction, but adherence breakdowns often occur. So, Brigham and Women's Hospital in Boston implemented a patient outreach program that improved medication adherence over usual care. In the outreach, health navigators contacted patients by phone. They managed medications based on remote surveillance of labs, blood pressure, and symptoms under supervision of a pharmacist, nurse practitioner, and heart failure specialists. Researchers evaluated adherence to guideline-directed medical therapy at 3 months in more than 1,000 Brigham and Women's heart failure patients. 197 of those patients took part in the outreach program, while the rest served as usual care controls. In the Navigator-led group, beta blocker adherence improved from 77% at baseline to 92% at 3 months. That's compared with an increase from 85% to 86% in the usual care patients. Adverse event rates were similar in both groups, although the Navigator group had slightly higher rates of hypotension and hyperkalemia, but no serious events. We'll be back with more medical news after this message.
Treatment of osteoporosis in older adults at increased risk for fractures declined from 2010 to 2014. That's based on a study of nearly 900,000 people. And Dr. Jeffrey Curtis says the underdiagnosis and undertreatment may be contributing to the increased disease burden patients are facing. Dr. Curtis of the University of Alabama at Birmingham spoke at the annual meeting of the American College of Rheumatology. He says that, given the aging U.S. population, the number of people at risk for fractures because of osteoporosis is expected to rise by 32%. Dr. Curtis and his colleagues assessed the impact of osteoporosis management on patients at increased risk for fractures. They analyzed data from nearly 890,000 Medicare fee-for-service members with an osteoporosis-related fracture from 2010 to 2014. During that 5-year period, the use of DEXA screening in this high-risk population fell from 25% in 2010 to 16% in 2014. The presence of an osteoporosis diagnosis in the study population also dropped from 7% to 4%. And the percentage of high-risk patients undergoing osteoporosis treatment at the time of fracture was 29% in 2010 and just 11% in 2014. Despite their history of fracture, more than half of the patients in each year's database had a comorbidity or were taking a medication that increased fall risk. Dr. Curtis says the findings show the need to improve management of people at increased risk for falls and fractures, not just to reduce morbidity and mortality, but to blunt fractures' economic impact on patients as well.
And that's it for the Daily Medical News. Be sure to listen to the newest episodes of CardioCast and the Post Call podcast, available today and every Friday. This week's stories were contributed by Alicia Alt, Doug Brunk, Jeff Craven, Randy Dortinga, Lucas Frankie, Richard Frankie, Alicia Gallegos, Tara Haley, Richard Mark Kirkner, Jim Kling, Alex Otto, Heidi Splete, Greg Twachtman, Michelle Sullivan, and Miriam Tucker. Our editors include Catherine Hackett, Gina Henderson, Elizabeth Meshkati, Jeff Evans, Lisa Nangolan, Mark Lesney, Laura McGlade, Laura Nicolaides, and Renee Matthews. Our news team is led by executive editors Denise Fulton and Kathy Scarbeck. And I'm Terry Rudd.
And I'm Molly Collegio. Thank you for supporting the Daily Medical News. We wish you all the happiest of holidays.